Dear students, as you all know, there are three important conditions in pleural disorders, that is pneumothorax, pleurisy, and pleural effusion. We have discussed pneumothorax in detail in the previous lectures. Today we can move on to the next topic, that is pleurisy. First of all, what do you mean by pleurisy? It's just the inflammation of pleura. Inflammation of pleura is called pleurisy. Usually, when there is inflammation of different structures, we will add an itis to it. For example, stomatitis, gastritis, ileitis, etc. But here we usually don't use the term pleuritis. We use the term pleurisy. That is the inflammation of pleura. Inflammation of pleura is otherwise called pleurisy. And this term is used to describe the result of any disease process involving the pleura and giving rise to pleuritic pain or evidence of pleural friction. That's the definition of pleurisy. It's a term used to describe the result of any disease process involving the pleura and giving rise to pleuritic pain or evidence of pleural friction. In dry pleurisy, we can classify pleurisy into two, that is dry pleurisy and wet pleurisy. Dry pleurisy is actually the pleurisy we are going to explain. Wet pleurisy is otherwise called effusion, pleural effusion. Then, when we discuss when we go into pleurisy or pleural effusion, we can see that it comes in the same disease process. That is, in the first stage, there can be pleurisy, and as the pathology advances or the disease condition advances, it will move on to pleural effusion. So it's maybe seen in the same spectrum of disease. Then let's discuss about the causes of pleurisy. What are the reasons behind pleural inflammation or pleurisy? And the causes include, first of all, infection itself. The main cause is infection, and there are various infections which can lead to pleurisy. That is, the most important one is pulmonary TB. Then pneumonia is there, lung abscess, bronchiectasis. In bronchiectasis, many organisms are involved in the disease process. Bronchiectasis, then rheumatic fever, then Coxsackie virus infection, amoebiasis, etc. In all these infections, there can be pleural inflammation leading to pleurisy. Then another cause is pulmonary infarction. Then causes like bronchogenic carcinoma, then injury to chest wall or injury, fracture of ribs. Then rheumatoid arthritis is another reason for pleurisy. Then lupus or SLE. Then polyarteritis nodosa, uremia. Then occupational disorders like asbestosis, all this can lead to pleurisy. Then other reasons are secondaries or secondaries from other malignancies can lead to pleurisy. Then lymphomas is another reason. Then lymphatic obstruction. Then complication of surgery in the abdomen or thorax. Then effusion in associate with ascites, pancreatitis. All this can lead to pleurisy. So there are a variety of reasons which can lead to pleural inflammation. And the most important etiological factor is infection itself. Then these are the etiological factors of pleurisy. Then we can move on to the symptoms. The symptoms of pleurisy is very important. We have to identify pleurisy. It usually, in majority of cases, it happens as a sequelae of other diseases, or as a complication of other respiratory disorders or other organ diseases. And we have to identify the stage of pleurisy. And so the main symptom we get in pleurisy is chest pain. This is the highlight of pleurisy, chest pain. And the character of pain is very, very important. And the pain is described as sharp, stabbing, tearing pain. Sharp, stabbing, or tearing type of pain. And this type of pain is typically seen in pleurisy. And the pain is worse on coughing, then deep respiration, pressure from outside, etc. So it's worse from movement or slightest movement, then on coughing, on respiration, on deep inspiration, etc. When diaphragmatic pleura is affected, the pain may be referred to the tip of the shoulders. That's another feature. There can be referred pain also if diaphragmatic pleura is affected, and can be referred to the upper part of abdomen when there is pleurisy involving the lower part of the lung or the lower part of pleura. So the referred pain can be to the shoulders or towards the upper part of the abdomen, depending upon the area of pleural inflammation. In case of the diaphragmatic pleura is involved, the pain is referred to the shoulder. And if the lower part of the lungs or the lower part of pleura is involved, it is referred to the upper abdominal area. That's about the pain. Then regarding the breathing, there is rapid, shallow breathing because the respiration in a study physical examination, I have mentioned that the respiration can be deep, normal, then deep or shallow. If there is a painful condition in the chest, the patient will take shallow breath. Rapid shallow breathing is typically seen in painful conditions involving the chest wall. So here also there is rapid shallow breathing, and there is unproductive cough also. Cough is not a main symptom, and if there is cough, there won't be much expectoration. Then at the onset there will be chilliness also. There can be intermittent fever also. So these are the common symptoms in pleurisy. First stage of inflammation. Then regarding the signs of pleurisy, what are the signs of pleurisy? As a rule, there is diminished movement of the chest. Diminished movement of chest on the affected side. The right side of the right side pleura is affected. The movement will be diminished on the right side of the chest. So the diminished chest movement is noticed on the affected side. And another important sign you get in pleurisy is pleural rub. That is an oscillatory finding, pleural rub. It has a crackling in quality and is heard both during inspiration and also during expiration. And it is localized. It is localized usually to a small area of chest wall, and is often better heard by increasing the pressure of the stethoscope over the chest. So that's about pleural rub. It is a rough sound, crackling sound, and it is heard during inspiration and expiration, and is usually localized to a particular area, or that is area pertaining to the area of inflammation, or it is localized, and it is better heard by increasing the pressure of the chest piece over the chest. Then we have to compare it with crackles also. We will get hoarse crepitation, bronchiectasis. Then what is the difference between hoarse crepitation and this pleural rub? And the difference is that unlike rails, it is not altered by coughing. In case of rails, if the patient cough, the position of crackle or crepitation may change. So but in case of pleural rub, the position won't change on coughing. And pain is also associated with the sound. There is intense chest pain, that is chest pain during both phases of respiration. That will be probably a pleurisy. And after the development of effusion, the pleural rub may disappear also. That's also an important finding you get in pleurisy. In the initial stage of inflammation, you will get pleural friction rub or pleural rub. That is, the pleural surface will be very rough, and because the surfaces are covered by fibrinous X-ray, that is very rough, and when there is movement, there will be a grating sound. That is that we can interpret or appreciate by auscultation. Then regarding the differential diagnosis, the main differential diagnosis is pneumonia, then myocardial infarction, and herpes zoster. There are three important differential diagnoses, that is pneumonia, myocardial infarction, and herpes zoster. Herpes zoster is coming in the reading because of the chest pain. In herpes zoster also there will be a presence of vesicles over the chest, usually over a particular dermatome or over the particular nerve root, especially in the intercostal area, and there can be history of chicken pox also, and it is associated with intense chest pain or pain in that area also. Then regarding the management of pleurisy, first of all, we have to advise rest. Absolute bed rest is essential because there will be intense chest pain on movement or even during breathing also. So the relief of pain is very important, and for that, in modern medicine they will give non-specific anti-inflammatory drugs or NSAIDs. Then counter irritants like caveolin poultice is another uh, method of pain relief. Caveolin poultice. Then applying hot water bottle, then giving analgesics, sedatives. All these are uh, modern medicine measures for pain relief. Then relief of cough is also very important because when the patient cough, there will be intense pain in the chest. So that's also very important. Relief of cough. For that, codeine preparations are there. Then specific treatment according to the cause. There are various reasons for pleurisy, and treatment of cause, underlying cause, is essential for clearing the symptoms. So that's about the management of pleurisy. Thank you.